starting with the rabies. Basically, it is a vaccine preventable disease. It affects the more than 150 countries all over the world. And for the rabies, dogs are the main source for the human rabies death. And can say around 40% of people bitten by rabid animals comes under the age of 15, under 15 years of age. So it is a 100% fatal disease. At the same time, it is a 100% preventable disease too. So that is the importance of rabies post-exposure management. And when it comes to the scenario, it is 95% of the human deaths occurs in the Asia and Africa regions. And I'm just, going to the management perspective, the post-exposure prophylaxis. And when it comes to the the transmission, so the mainly the virus is transmitted through the bites. I am talking about the human rabies. So the bites from the infected animal. So that is a mainly that is the transmission goes through, and then then licks on broken skin or mucous membrane, and scratches or inhalation. Fortunately, in Indian scenario, it is not there. So that is actually a part of bat rabies. Indian bats, as of now, there is no documented evidence suggesting there is the transmission of rabies from the bats in India. So it is possible in the vampire bats. So that is in the American caves, where the droplet transmission is there. That is from the even bite is not required. So fortunately, till now in Indian scenario, there is no bat rabies has been reported. And then from human to human transmission, not through direct contact, but the documented evidence suggests that. So that is through organ transplantation. That is mainly by corneal transplantation or kidney transplantation. So these are the mode of transmission. And so here I just want to emphasize certain things, basically which I already told. So the animals which transmits rabies in India, so that is mainly it is the dogs or cats, and the peri-domestic animals, that is cows, buffaloes, these pigs, donkeys, these can also be possible. So mainly the dogs are the major culprit for transmission of rabies to humans, and not reported in India. Bats do not, it's not reported. Rodents, birds, rabbit. So I just want to add a little bit to in the rodents part. So nowadays we usually, when you see in the casualty and all these areas, so you usually give a vaccine for rat bite. So there is a little bit of confusion happening. Because of that, these rat has been included in the post-exposure. So the rat, especially the bandicoot, perichari. So basically, the name bandicoot actually is a marsupial, and it is present in Australia. So it can make transmit rabies. But in Indian, that perichari that is actually Bandicota bengalensis, or rather it is called lesser bandicoot rat. So അതിൽ ആ bandicoot എന്നുള്ള പേര് അതിന്റെ അകത്ത് വന്നതുകൊണ്ടാണ്. So that is being included in the rabies prophylaxis. So there is pala literature I had tried to find out. So there is no literature I could find with the any this Bandicota bengalensis or perichari അല്ലെങ്കിൽ any rodent bite in the Indian scenario rabies transmission. So even status paper 2018 WHO status paper also suggests that. So rodent bite do not require any post-exposure rabies prophylaxis. So why I emphasize these two things about the rat and bats. So I've seen a lot of the materials, that is being spread through from the നമ്മുടെ ഗവൺമെന്റ് ഇതിൽ തന്നെ. സോ പലപ്പോഴും ബാറ്റ്സിന്റെയും റാറ്റ്സിന്റെ ഒക്കെയാണ് സോ ഒരു ഈ പറഞ്ഞ ഫോട്ടോസ് ഒരു റാബീസ് പ്രൊഫൈലാക്സിസിനായിട്ട് ബന്ധപ്പെട്ട് സോ ദാറ്റ് ഈസ് ബീങ് പ്രൊപ്പഗേറ്റഡ്. So the people seeing those things get very much afraid, and when they come to our OP, so most of the scenario they won't be given rather they won't be given a vaccination, they get offended. So basically because these IEC materials has a these bats and rats in it, and why are you not giving us vaccine? So these kind of conflicting questions they will be asking, because even there is a IEC material provided from the which is being shown in front of the preventive clinic has a bat in it. So that makes the people quite confusing. So you should be it has to be very clear. In Indian scenario, bats do not transmit rabies, as well as the rats. Right. So these are the animals which I already told. These can transmit rabies in India, and these are the animals which do not transmit rabies in India. So birds do not transmit rabbit, rat, reptiles, amphibians, bat, fish. So even in rabies virus has been identified from a hen, but there is the transmission has never been founded or documented. So birds as of now do not require rabies prophylaxis. Coming to the post-exposure prophylaxis, there are 4 things which you need to focus on. That is a local management of wound, vaccination, either in the intradermal rabies vaccination or intramuscular rabies vaccination, immunoglobulin, either ERIG or human rabies immunoglobulin, then advice and counseling. These are the things which you need to focus on the post-exposure prophylaxis. So the first part, that is a wound management. That is you need to make sure that around 15 minutes, you need to clean the wound or the exposed part. At least it need to be cleaned under running water for minimum 15 minutes, and if possible, they can apply virucidal agents like spirit or povidone iodine. And the wound, if there is a wound, it should never be kept tightly packed. So because if you are keeping the wound tightly packed, so the innate tendency of the body to expel the virus is you can say that is being taken, that will not happen if it is tightly packed. So that the tight packing should be avoided. So you can use, if there is a need of packing, it can be loose packing so that the discharge can go outside, so the mechanically that the virus will be expelled as part of the immune response. Right. So already we discussed that is water and soap for 15 minutes. You can use the povidone iodine or spirit, and tetanus prophylaxis if required. So basically the tetanus prophylaxis, usually as per the schedule, it is if there is no history of previous vaccination, the schedule is 0, 1, 6 months or to 12 months. So that is a schedule. And if there is no history of tetanus vaccination, you need to give a tetanus immunoglobulin as well. And if they have taken the tetanus previously, so within 5 years there is no need of giving the tetanus toxoid. And the suturing should be avoided. So if there is a suturing is required, so that should be done after immunoglobulin is infiltrated. So coming to the categorization. So the category, there is a, it is categorized into category 1, that is a mild exposure, category 2, moderate, and category 3, that is severe exposure. And the category 1, that is a touching or feeding suspected animal or licks on the intact skin. So basically, there is no injury from the animal side, that is from the animal. So if the animal is observable, and that means you can see only 2 animals are considered being observable, that is a dog or cat, only can be considered as a observable animals in case of rabies, because even though other animals are physically observable, they cannot be considered as observable animals, basically because there could be a carrier state for those animals. In dogs and cats, the carrier state is very rare, so that can be observable. If the category 1 and the animal is a dog or cat is observable, so only the external cleaning is enough, and you need to observe the animal for 10 days for any abnormalities. And if the animal is not observable, if it is a stray dog or stray animal, then we need to manage it as a category. So coming to category 2. So category 2 means the nibbling of uncovered skin, minor scratches or abrasions without bleeding. And for that, category 1 management, that is a wound management, anti-rabies vaccination, antibiotics, and tetanus prophylaxis if required. Coming to category 3, that is a severe exposure. So that is a licks on broken skin. So which was considered as a category 2 previously, earlier, and now it is in the category 3 the category, and it is a transdermal bites or scratches with oozing of blood, contamination of mucous membrane with saliva. So this is the category 3, and the management is category 2 management plus rabies immunoglobulin. So just category 1 is just touching, feeding, or licking the licking. So category 2, that is superficial abrasion, no oozing of blood or bleeding. So category 3, that is a severe exposure, especially the any injury above the neck. You can say that is a category 3. Wounds with oozing of blood, lick on broken skin. So we have first thing is about the vaccine management for the category 2 and category 3. So we need to give anti-rabies vaccination. So there are 4 types of vaccines, modern tissue culture vaccines are available. There is a first generation vaccine, that is a purified duck embryo culture vaccine. So that is the one brand name was Vaxirap, and then you can see human deployed culture vaccine Rabivax was there. I don't think right now it is easily available. And the next is a purified chick embryo culture vaccine. That is a Shirorab. It is right now, I think, available from the KMCL. And the second generation vaccine, that is a Vero culture vaccine. So that is the available as Verorab, Averab, and so many these things. So the 4 types of modern tissue culture vaccines are available in India. So coming to the post-exposure vaccination, there are the 2 regimens are approved by drug controller. So one regimen that is in the intramuscular schedule. So that is a SN regimen, and all the type of vaccines which we have discussed can be given as intramuscular regimen, and the dosage is all the first generation vaccines. The dose is 1 ml, and virus culture vaccines, it can be given as 0.5 ml or 1 ml according to the package insert. The route of injection is it should be given intramuscular, and it should be given intramuscularly into the deltoid muscle an inch above the insertion of the deltoid, or it should be if the child or the person do not have adequate mass in the deltoid, or if there is any contraindication in giving the vaccine in the deltoid region, it can be given in the anterolateral aspect of thigh. And it should never be injected into the gluteal region, because because of the subcutaneous fat, so the absorption will be delayed, and hence the immune response also will be delayed. So the schedule is for the SN regimen, it is 5-dose regimen, 0, 3, 7, 14 and 28, and it is the day 0 is the date of starting the first dose of vaccine, and not the date of bite. It has to be calculated from the day 0, that is the first dose of vaccine, and the vaccine dosage is same for all age group or weight. And you can remember, one ampule is for one person, whether it is an adult or child. So it should be given either in the deltoid or you can say anterolateral thigh, and should not be given in the gluteal region. And for the other schedule that is approved by drug controller is the intradermal regimen, that is the updated thigh red cross regimen is the approved one, and the dose is 0.1 ml per ID site, or the 2 ID sites opposite. So usually give in the upper arm over each deltoid in the both sides. And the schedule is 22202. That means, so for the intramuscular schedule, we give 0, 3, 7, 14 and 20. For the intradermal, so day 14 is not there, only 0, 3, 7 and 28 alone is there. So this is a photo you can understand. So there is a day 0 you give 0.1 ml each deltoid site, 0, 3, 7 and 28. So you can see when the intradermal, you can see a PUD orange appearance, and you can see around 4 to 5 millimeter of blood. So if it is properly given. And coming to the category 3, for the category 3 exposure, you need to give the passive immunity as well as vaccination. So that is indicated by rabies immunoglobulin is indicated for all the category 3 except in 2 scenarios. The 2 scenarios are, so it can be given up to 7 days of starting the vaccine, but it should not be given after 7 days of vaccine, because you can see the antibody response starts after day 7. So if you are giving the passive immunity after day 7, it can suppress the active response. So the immunoglobulin should not be given after starting the vaccine. 7 days after starting the vaccine. And second scenario is the full course of vaccination has been given either as a post-exposure prophylaxis or a pre-exposure prophylaxis. In those scenarios, only day 0 and day 3 single site is required in the case of IDRV. So IMRV anyway, so the 1 vial each on day 0 and day 3. So in the case of pre-exposure, that is pre-exposure schedule, you need to give day 0, day 7 and day 28. 3 doses are given, and when you get an exposure, you need to give a booster dose of day 0 and day 3. So coming to the rig, there are 2 types of rig available: equine rabies immunoglobulin and human rabies immunoglobulin based on the source. And the dosage is 20 IU per kg for the human, and I can say equine it is 40 IU per kg, and the maximum dose is 10 ml, that is for the 75 kg. And it should be infiltrated into the wound, maximum anatomically feasible into the wound. And it should be if there is a more number of you can say wounds are there, it can be diluted and all the wound should be infiltrated with the immunoglobulin. So it should be infiltrated into the wound. It should be infiltrated into the wound, and it can be given around the wound also. So coming to the advice part, so we need to give, there is no dietary restrictions except excessive consumption of alcohol that can interfere with the immune response, and there is no restriction of physical activities, and you can advise for the any adverse effects to if there is a, and just added a daily bath basically, because so when I was in the in 2004 I was in Kottayam Medical College, and that time so the schedule was IM schedule, it was 03 7 30 and 90. So even after 90 days patient used to ask me can I take bath now onwards. So we need to proactively tell them. So you can, this is only a prophylaxis. You can take the bath. There is no restriction as such. There is no restriction of going to, office or school. Yeah. So a little bit more about the. So these are the things which I had taken for the NCDC guidelines. So now there is a little bit about the COVID scenario. We need to. So there is a guide, advisory or guidelines by the APCRI. So which I would be little bit discussing on those things. And about that, so you can say, can we give rabies vaccine and immunoglobulin to animal bite if they received COVID-19 vaccine recently? Yes, it can be given. So even if they have received any dose of either first dose or second dose, so irrespective of the dose, the rabies prophylaxis is the primary importance that need to be. That's a life-saving drug, and that need to be given as early as possible. And can the rabies vaccination and COVID-19 vaccine be given on the same day? Yes, it can be given on the same day, but it should be given in the different sites. So if the intramuscular schedule, it can be given in both, we can say both arms. And so can we give intradermal dose in the same arm where COVID-19 was given as IM? And it is better, you can say, because both intradermal, there is the dosage is on the both sides. So in that scenario, you can go for a suprascapular region or anterolateral thigh, where you can give intradermal vaccination. So can rabies vaccination interchangeable based on the brand or type of vaccine? So it is better you need to continue the same type, and it can be allowed if in unavoidable situations to ensure the completion of BP, and if there post exposure prophylaxis is if there is a 1 or 2 days are there in the schedule, they changed in the schedule, or if within 10 days of the first 03 037 doses. In that scenario, if the 3 doses has been taken in the all the within 10 days, there is nothing to be changed. That can be continued. And if the vaccine is missed, then you can think about adding one more dose. So when should the second dose of COVID vaccine be scheduled? If the person is exposed to animal. So the first importance need to be given for the rabies vaccination. So full course of vaccination need to be given, and after the last dose of vaccine, at least 2 weeks of gap should be given to the for the COVID vaccination. And similarly, after receiving the rabies vaccine, when one can take the first dose, same there should be a minimum 2 weeks of is there any change in the dosage? There is no change, or for the IM or ID, so there need not be any change as such. So these are the references which I was mentioning about. So NCDC guideline in 2019 that has not been till now is not updated, and from the APCRI, so that is the biggest association in the control of rabies in India. So that has got all the veterinary doctors as well as all the people, stakeholders in that association, and the advisory date is on the 5th June 2021. Thank you.
Thank you, sir.